Hello guys. So now, as we have already discussed the classification of the mycosis, right? So we have discussed tinea, dermatophytes and all. We have also discussed regarding the sporothrax. So we have discussed the entire classification. Now for all of these fungi, there will be a common treatment, there will be a common diagnosis. Okay. So guys, we have discussed the mycosis part, right? We have discussed cutaneous, subcutaneous mycosis. We have discussed different types of tinea, right? The dermatophytes, tinea versicolor and all. So the treatment part. So before discussing the treatment part, the studies, whatever you do, the diagnostic part is common for all of them. Okay. So let me put up a picture. So look here guys, I have kept a picture here. So as you can see at this picture, the diagnosis for almost all these things which I have spoke before, right? The diagnosis for all of this classification is same. So that is KOH mount with blue fungal stain. Blue fungal stain. So this is a KOH mount preparation. Now in this preparation, you will be able to see all the different types of fungi. So here you can see that these fungi are long, these fungi are branched. So you can see very good extensive branching of this fungi. And you can also see another thing that within this, these are called as hyphae. For example, let me draw it so that it would be clear for you. For example, this is how it branches out. So whatever I'm drawing right now, all these are called as hyphae, right? So whatever I'm drawing right now, all these are hyphae. These are all called as hyphae. Now to this hyphae, there is extensive branching in this way. There is extensive branching in this hyphae. Okay. Another important thing is that between the hyphae, there are septa like this. So that is why you call this hyphae as septate hyphae in this way. You call this hyphae as septate hyphae in this way, right? So you call this hyphae as septate hyphae. So all these things you can see on this mount preparation. As you can see here, you can see the hyphae, you can see the septa in between, you can see the branching of this hyphae over here, right? So all these things you can see. Now when it comes to the treatment will be more or less similar to all of them. When it comes to the treatment part, the treatment will be more or less similar to all of them. We basically use two different types of medications here. Okay, so one is called as oral medications like oral antifungals, and we also use topical antifungals. Right? So wherever oral is not possible, you give topical, and vice versa. Wherever topical is not possible, you give oral. For example, in case of tinea capitis, if you put topical antifungals, the cream, the medication does not enter down, right, to the site of infection. So you use oral antifungals that time. So this is the thing. Okay. Now most of you might think, why can't we use steroids? Okay. Why should we not use steroids all the time? Because usage of steroids in such kind of fungal infections will lead to a condition, right? Will lead to a condition called as tinea incognito. What do you mean by tinea incognito? It would lead to a condition called tinea incognito. So what is tinea incognito? Tinea incognito means persistent fungal infection. So the fungal infections keep on coming, and will there be any symptoms? No, there will be no symptoms. That is why it is a incognito mode, no symptoms. So tinea infection without any symptoms is called tinea incognito. So patient will have recurrent relapses of this tinea incognito. So for that reason we don't use steroids. So regular use of steroids would lead to tinea incognito. So this might be an important question. Okay. Now when it comes to the oral antifungal drugs, When it comes to the oral antifungal drugs, what are the important drugs you see? One is called as grisofluin. Grisofluin, right? Second important thing is itraconazole. Itraconazole or fluconazole. Itraconazole or fluconazole. Third important thing is terbinafine. Terbinafine. So, grisofluin, itraconazole or fluconazole or terbinafine. So, these are some of the oral antifungal drugs. Now, when it comes to the next group of drugs, that will be topical. Topical antifungal drugs. So, what are these topical antifungal drugs? Page tipte telisidi. So, what are these topical antifungal drugs? The topical antifungal drugs are, one is terbinafine cream. Terbinafine cream. Okay. Next, there is also ketoconazole cream. Ketoconazole cream, terbinafine cream, and clotrimazole cream. And clotrimazole cream. Clotrimazole cream. So these are some of the topical antifungals. So we have discussed regarding oral antifungals as well as topical antifungals. So this is all the important things which you need to know regarding the diagnosis as well as the treatment, and also the classification of the mycosis. Okay, this is, I think this would be more than enough for you to cover up all the MCQs. So thank you so much for watching my video. Goodbye.